Okay, so this video, we're doing more tennis elbow right here. And so the shoulder pain video I did, her tension was more in the rotator cuff area back here. But this one, this shoulder, the tension is right in the front area here. So that means, because that tension following down leads all the way to her thumb here. So the tension in her thumb, I can feel there's a big protrusion right here, and the tendon is twangy like a guitar string, and so that means up into her hand, it's gonna be the thumb area, or on the inside of the thumb, which means the tension here probably can lead up to some neck pain or neck tension. So with her, it's a matter of getting this spot, not the outside of the thumb. That one's not bad. But the inside thumb area right here, there's a little lump right there where the nerve doesn't want to turn off yet. So it's probably pretty tender. So I'm pushing into the thumb and down towards the joint to try to get that to release. Doing a little motion to help it deactivate. This one's tight. And there's more, because I got the one right on the edge there. But it definitely feels like it's tight at the base right here. So right above it, it's gonna be right here. Just got another tight spot. Take a deep breath. Definitely melted. I even heard her stomach bubbles move, like she relaxed more, so that's good. Alright. Oh, and the joint went where it should. So that means I'm done right there. And then maybe the base. So she mentioned that when she was a teenager, she jammed her thumb pretty good and never got it checked. So the tension in the base of the thumb joint, I believe, is the source of what's leading up to her elbow, and that's why she's feeling it so much right in the elbow. Because typically what I've found is where you feel the most pain, it's just distal to the pain where the soft tissue adhesions are that were probably damaged from an injury. So it travels up towards the core, causes extra tension and compensation there. And I think it's not going to be perfect because it's not bad right on the edge there. A little bit tight, but it's the inside of the base of the thumb. It's just really tight. So I'm trying to push everything down towards the wrist right now. Stretch it towards that way. Alright, right in there. It's only gonna get so good in one session, but there. That's where the protrusion is. I don't know if you guys can see that. Right there. So that's the indicator of where we need to release. Okay, it's better. So I'll hold the thumb straight while I do joint manipulation. It definitely moved. Might not be perfect, but there. Still tight right here. That's not gonna let everything move like it should if I don't release this first. So with what I'm finding in the hand, I also found that it likes to copy in the foot on the same side. So the tension here, I'm gonna use to know where to work on the foot. So it's gonna be more of the big toe area on the midline, and then secondary lateral line on the inside of the pinky, which means I probably need to release the pinky too. Right there, I feel it. Take a deep breath. Okay. Nope, that moved. Not where it should. Okay, I think that's all the hand is gonna let me do. So in the forearm area, most of our pain is here. It definitely feels really soft, like it's overstretched, because it would be this movement that would overstretch it. So it's really weak going this way, which means if I release in here, that is going to allow the tension to reduce off of the opposing side. And it definitely feels like there's some adhesions right in here. But it feels a little more superficial, like factual adhesions. And I need some cupping. So it's almost like the muscle has stayed in a flexed position for too much time. And it just kind of gets glued, stuck that way. Yeah, it's definitely breaking up right in this area. It's still popping a little bit. Deep breath. Okay. Definitely released it quite a bit. So now that I've got the hand and the forearm worked on a little bit, I'm gonna see if, let's see if the shoulder is gonna let go. I did a little bit of this in the other video already. Shorten it to disengage it. Oh, that one popped a little. So that's probably gonna be nice and happy now. And then let's see, this spot right here. Okay, so this arm was all mostly midline. So midline as in thumb to front of the shoulder and affecting up to the neck. So it definitely feels less like it's like a guitar string. And there's just a little bit of adhesions right here. Okay. I think I got this arm as good as it's gonna get. So based off of that, we're gonna use that info for the leg to treat that because she's having low back issues too. So over this way. Okay, so like with the arm, whoa, sorry. So like with the arm, I'm actually gonna work the foot first. All right, you're gonna get a good view of this. All right, so like I was saying, can you see how her toe is like bent down this way? Because it's too tight. So her toes kind of do that too because it's so tight in there. But the biggest indicator is when you can find a callus on their foot. It kind of tells you where they push off the hardest. But this one's not bad, actually. It's actually a lot tighter right here. So, easiest way to find it is you look at the base of the toe, right? You see how the toe is like pointing that direction? It's still pointing that direction. Most toes do that. So, just like her thumb is tighter on the inside here. So you go right above the joint and you find, oh, it's popping under my finger. But you find it's like a lump, a tension lump. Push on it and then down towards the joint. It should be tender if you're on the right spot. So you don't have to push super hard because they're probably gonna react, but you want to push hard enough to get it to let go. So primary is right. Also, that was tight on her thumb, but it was also tight on the front right here. Okay. And the joint is moving exactly where it should. Get that stretched out there. So I'm trying to pull everything down this way and stretch it this direction. She's really tight right in there. And then just like on her hand, we go to the pinky, and it was on, not the outside, it was on the inside, right at the top. The pinky toe's kind of hard to get sometimes. I have to hold it from behind to get it enough pressure. But pinky toe is secondary, but working on both is going to help. And this is really just to get the leg and the hip to disengage and relax so you can actually work on it. Okay, got the foot to release pretty good. So now we'll do a hip release just like we did on the shoulder. So with the shoulder, if you remember correctly, it's right here. So if this is the knee and this is the ankle, then this is going to be more of the medial part of the hip. So in theory, my guess is it's not going to be holding here. It's going to be more on the inside area here. So when I do the leg rotations, we'll see where it is. Alright, so over here already, we've got a good rotation there. So if I push towards the middle, it's actually, I feel a twang right in this area, catching there. So like with the shoulder, you can't see. So like with the shoulder, you find the spot that's holding, and you get right to the attachment point. Okay, I'm going right to where the muscles attach. And then push the knee in to completely relax the muscles. And then I'm pushing down towards the table too. So all of that is gonna disengage the compensating muscle so that the hip can actually relax. And it's actually not that bad, just like her shoulder. Most of the issue is at the extremities. And I'm just gonna get this one released real quick. And I like to do palm towards the leg so it's less invasive. And then I'll grab my other hand behind the elbow so I can get more pressure into my fingertips when I need it. that moves a little better. It wasn't bad, but it's better. So that's kind of an idea on how to work on like when the elbow's bugging you, or when there's similar pains on the same side of the body. So the left shoulder and the left hip will kind of copy each other. So that's why I just wanted to show you how the thumb, her thumb here, is kind of the big culprit for the big toe and the foot and the pain up into the elbow. So, alright, that's it.